Okay, welcome everyone. I'm going to share my screen. I'm Phoebe Walker with the Western Mass Public Health Association and the Franklin Regional Council of Governments. We're pleased to see you here. If you are just joining us, please put your name, town, and role in the chat. And if you have questions along the way, please put those in the chat too, and we will find time at the end to get them all answered. I'm going to put in also one last time here the link to the webpage that has the slides for today and the various materials that we're going to talk about. And I want to introduce our presenter, Jeff Kennedy, and then we'll get started with the slides. So this is Jeff Kennedy, Health Inspector for the Town of Williamstown.
Well, good afternoon.
Good afternoon.
Good something. Good Wednesday.
Good to see you. And then let me just get the slides up and in a place where you all can see them, and we will get started. This is more people than I'm used to managing on a, let's see now. So question for you all, are the Zoom gods with me or not? Are you seeing the screen or are you seeing the version that is the notes? Jeff?
In the screen.
Okay, great. All right, so you came here today, folks, to go to the Pre-Rental Housing Inspection Regulations 101, and we're glad to have you here. This is what we're going to do in the next hour and a half. We're going to talk about why these are an interesting tool, what they're useful for, what the benefits and challenges are of them, what Williamstown's model is from Jeff's many years of using it, how to pass a local regulation, and then have some time for your questions and answers. And to make that as efficient as possible, if you can put your questions in the chat to me, or you can do it to the whole group, but I will be trying to manage the chat so that Jeff can answer your questions. Also, if you want CEUs for this workshop, you can get that from Miha has offered to do that, but you will need to let me know. So I need your, name, email, address, and town. And we should have collected all that when you registered. So I just need to know that you are one of the people who's hoping for the CEUs. So let me know that during the workshop. And again, if you've just joined us, please do put your name and town in the chat. So just to get started, what are we doing here? Why are we doing this? We are looking at pre-rental housing inspection regulations because housing is such an important determinant of health. And I just want to draw people's attention to this sort of helpful infographic around how people's health outcomes are created and the complexity of the systems that end up driving people's access to employment and housing, people's access to a built environment. A lot of that is rooted in a whole lot of baked in inequities in our country. But one of the main things that impacts how people's health outcomes, which are these things up here, are created, is their access to housing. And so this is a tool that you as local health departments have access to improve the experience people are having living in housing. And that's why we thought it would be helpful to just learn about how it works in case you might like to do it. And I'm going to turn it over to our speaker.
Well, good afternoon, everyone. Again, I'm Jeff Kennedy. I have been the health inspector in Williamstown for 150 years, give or take 10 or 15. But in that time that I've been in Williamstown, we've been doing pre-rental housing inspections. Our regulation was actually created in the late 1970s and it was updated in the mid 1990s. Anyone who knows, anyone who does housing inspections knows it's one of the hardest things we do. I have colleagues who are no longer in this business because housing inspectors can be such a chore. And a lot of the reason the housing inspections are such a chore is because you get them by complaint. You're getting called for a situation where landlord and tenant relationships have broken down so much, you're getting called to do a Chapter 2 housing inspection on a unit you may know nothing about. And when you get there, you're like the referee in a boxing match, except while both boxers are taking shots at each other, you're getting slapped around yourself. So how do we try to eliminate some of that conflict, some of that abuse? And years ago, Williamstown and other towns in North Berkshire County, North Adams is one. Adams came along in the early 2000s with pre-housing inspections, felt that to have a pre-occupancy inspection would give the inspector a chance to go in while the unit is empty, get a good look at the unit, allow time for that unit to be brought up to code, and allow the tenant to go into a safe and suitable housing that meets the provisions of Chapter 2, the Housing Code. Next slide, please, Phoebe. By the way, I want to thank Phoebe for doing these slides because I'm like a technical Luddite on that. So we're getting renters into safe homes that you don't have to look to try to find something wrong, because hopefully in the pre-rental program, you'll have found it, you'll have taken care of it, there won't be an issue. And then housing will come up to the Chapter 2 standards. When I first took over the program, the first round of inspections was tough. And I will tell you that the first round of inspections were tough because we were dealing with everything from handrails to bad plumbing to smoke detectors, and later on that became smoke and carbon monoxide detectors, to sometimes having landlords having to cut in a second means of egress to bring the code up, bring the housing up to code. And remember, the title of any code we work with in Massachusetts is minimum standards. Any code you work with, if you look at the title, it says minimum standards for X, Y, and Z. So by doing pre-inspections, one, we get the better quality housing, we know what's going on, and hopefully that's going to, once the initial inspection is done and the landlord, the property owner, has everything they need corrected, then it's just maintenance. It's keeping an eye on the housing. And it allows us to know the landlords, work with the landlords. Next slide, please. Landlords have used, it's a learning curve. Sometimes landlords are upset when this first comes in because they make the assumption, oh, this is going to cost me a boatload of money. And the first inspection for any housing, yeah, you're going to find things that the landlord wasn't aware of or wasn't aware that was part of the code. So they'll be bringing it up to code. But once they bring it up to code, they will have what Williamstown calls a certificate of compliance to show that when they rented this unit, it met the provisions of the Chapter 2 Housing Code, which is a protection for them because they can show later on complaints, this met the code when you moved in. This was inspected by an impartial inspector, the health inspector, the health agent, whatever you want to call yourself, and it met the housing code. It's going to cut down on court time for you, the health inspector, and hopefully the landlord and tenant, because we have a verifiable and quantifiable condition of that unit. And that's what the pre-rental inspection does. It can tell, it will help them. There are other things. It brings up the quality of the unit. It brings up the quality of the other units. And sometimes the property owner will find, well, hey, I've got a better unit than I had before. This unit's worth more to the consumer than it was before it was accepted as Chapter 2. And from your end, when you first deal with this and as you go along, and I've been doing this since I started in Williamstown, you will send out as many helps and as many bits of information that you can get to not only the property owner, but the tenant. And that may include some of the things we'll go over later in the resources thing, but also things like the Attorney General's rental guide. So you became not only a source for the tenant, but also a source for the landlord to help him or her work through those problems. Next slide, please. we have seen in Williamstown, since this program started many years ago, and particularly since I took over the program, the condition of units, of rental units, has steadily increased. So that a lot of times I can get the point these many years later, okay, it wasn't 150 years, I was just funning about that, okay? It's only 130. Now, almost 30 years I've been in Williamstown doing this. The inspections get easier. You're assured of the quality of the units when they get easier. You have a sense of trust or distrust with the property owner so that you know how to address your units. There are some units I will go in that have been inspected many times before, and it's a walkthrough, everything meets the code. Remember, the Chapter 2 code is a function code. A lot of times it's not an aesthetic code. Everything meets the function code of Chapter 2. And I can just walk through and say, okay, go ahead, rent. If I'm comfortable with the property owner and we have a good relationship, there may be a minor thing wrong. I said, okay, I trust you, fix it, and we're back up to code, and it will get done because you've established trust with the property owner. When you get to the tenant, the tenant will call and ask a question. I will say, when I inspected this, this was the condition of the unit. This is what we're seeing. So using the war stories, calling with tenant gets a complaint, hey, there's a hole in my wall, there's mold all over the bathroom. And I will tell the tenant, the hole wasn't there when I inspected. We inspected specifically before you moved in. We know that the ventilation and the fans were working correctly in the bathroom. If they're still working correctly, then the issue is probably not the property owner. Remember, as the housing code inspector, the health inspector, you will be citing landlords and tenants for this. And that pre-inspection gives you that flexibility. Usually you get called in on a complaint. You're going in there cold. You haven't inspected it. It's hard to assign responsibility for a violation. If you have a pre-inspection program, you have a better handle on what's going on with that unit. And because of that, I do a lot of pre-housing inspections. We're a town of 7,500 roughly. We have 600 to 700 rental units. I've been through all of them many times, and because I've been through them all many times and we've corrected issues or taken care of issues that have come up, I don't get the complaint inspections that I used to. I do very few complaint inspections. And although I've done housing court time, I don't do as much as my colleagues who don't have a pre-rental inspection program, because it becomes less of a battle, less of a he said, she said. And when I do go into housing court, I have my documentation that this is the apartment, this is when it was certified. Before it was certified, the property owner took care of these issues. Or if I go in, I think the property owner took care of these issues, but X and Y happened and there wasn't a good fix on it. So you have a handle on that apartment. And what you're doing as Board of Health members and agents, you are creating an impartial regulation, a local regulation that goes for everyone in town. We have Williams College in town. We have high-end housing. We have middle-end housing. We have low-end housing, but every property owner gets treated the same. They go through the same inspection process so that there is no accusation of favoritism or that you're not inspecting Williams College because they've got power and they have so much presence in town, but you're picking on the little guy. No, everyone gets inspected. Everyone is held to the same function standard of the housing code. Next slide, please. We started this out, and when I started working in 1995, there was a bit of a lag in the housing inspection because my predecessor had died many months before I got there, and the building inspector was trying to keep up, but he couldn't. And at the same time, There were housing units we were just finding out about, so we were doing initial inspections on those. And I'll tell you later how to find your rental units, which is fairly easy to get most of them, at least capture 80% of them. And we did have some landlord resistance, and we had, again, this is going to cost me a lot of money. You're picking on me, but once they got into the system, it became automatic for them. Hey, Jeff, I've got a new tenant moving in. I need an inspection. And they can go, I can go in, I can inspect, and I can get it certified or repaired. The hard part is, what if there's a common condemnation? And I try my best to do that, not to do that on occupied apartments. If I go into a unit that isn't occupied and it's in poor shape, yeah, I will condemn it. You cannot rent this until X, Y, and Z is fixed. If there's a tenant in there, we look at the tenant situation, we look at the scope of the inspections, and we're able to talk to the landlords. How can we take care of the most serious inspections so that I don't displace people? And that's worked well for 20 years. We've never ended up with a dangerous situation that tenants were living in after I've gone in and looked it over. And once you start working with both the landlord and tenants, sometimes they even start talking to each other because they're seeing a resolution to their problems. Yes, you could encounter tenant violations, and a lot of that, I've had hoarding issues. I'm really concerned about hoarding issues when it's part of a multifamily dwelling, because we're affecting everyone else in that health problem. And I'm able to work with the tenants on that. The last one I had, I was able to work with the tenants to tell them, listen, I should be condemning this unit. Do you have a place to go for the weekend, a family member that you could go and get this place pretty much hoed out by the time I come back on Monday to see if it's good enough that you can live there and still correct your violations? And that has worked for me. It's worked in several cases I have had on that. And the tenants have to know, and they will know that violations sometimes are there. They're not maintaining their unit in a sanitary manner. They're pulling off the smoke detectors or the batteries in the smoke detectors. I'm not good. Yes, rents can increase as the quality of the unit comes up. I don't get into the money aspect of it. That's a landlord tenant thing, and it's based on lease. When we get to the Chapter 2 housing form, tenants can ask for legal help. I'm not a lawyer. I don't play one on television. So if it's not explicitly spelled out in the code what the legal remedy is, I don't get into it. I have them consult legal counsel. There are always housing assistance services wherever you live across the state. They can call those. Next slide, please. If I'm moving too fast, somebody let Phoebe know I'm moving too fast. The Williamstown model started out in the late 70s, was updated and moved to the 90s when I started. So it became a process. And if you haven't done a housing regulation yet, part of what you do, should you adopt the regulation, is you give enough time to let the landlords know what the requirements are. And then you start. In Williamstown, we have an online permitting program. Our online permitting program also takes care of Chapter 2 housing. The landlord will apply, we'll schedule, we'll inspect, we'll use the Chapter 2 housing code to determine violations and correction times. We'll talk to the landlord, we'll talk to the tenant on how. Years ago, I was told by the Department of Public Health, 30 years ago, you probably know who I'm talking about, he's no longer there, he's retired, that we're not supposed to help out landlords and tenants trying to resolve a situation. If you're a health inspector, you know that doesn't work. You know you're going to be discussing this, well, this is what it's going to need to bring it into code. We'll give them tools, which will sell cheat sheets. We'll send out orders of correct. And in the 30 years, I've tried to make things as simple as possible. If you're a one-man health agent for a town, small town, if you're the housing agent for a large city and that's all you do is housing, you still have the same issues. How do I get the desired result in the shortest time with the least amount of paperwork? So why don't we go to the resources, please, Phoebe, and then come back to the slide. Can we do that?
Yep. Right, 1 second. Let me just get that page up. All right, I think now we're good. Here we go. Okay.
Okay. The stuff if you want to drop down, we can go to the other stuff later. But when I'm doing inspection, rather than having a whole form, and a lot of it's in my head now, what I do, but a lot of times if you're just starting out, how do you make this easier for you and the property owner to know what they have to do? So I created the cheat sheet, the Chapter 2 housing cheat sheet. It's the first thing. And these I give out to landlords, I give out to tenants.
Want me to click on it there so people?
Yeah,
can see it?
please.
Are you all seeing it now? Jeff, is it visible?
Yeah, I'm seeing
Okay,
it.
okay.
Wonderful.
Great.
And it gives them in the short amount of time. One, that's everything the Chapter 2 housing code covers on page 1, so we'll know the scope. When you're just doing a first housing inspection, this housing code helps take care of most of the problems. That would be page 2, Phoebe, on this.
Oh, okay, yep.
There we go. The housing code helps, takes care of most of the things that you're going to find when you're doing housing inspection, and it's a short way for the landlord to know, I have to take care of these things, or for the tenant to know, oh, this should be like this, and it's not. Going down to page 3, there are other things, and I've just broken them out of the housing code itself, and I keep them with me because sometimes I need a more specific citation when I'm doing a housing inspection, and I'll show you that in a minute. And this is just the easiest way and the shortest way for the most common violations. I will give this to the landlord. I will give this to the tenant. I will keep this for myself because it makes it easier to put everyone on the same page on what you're looking for housing inspections. You can keep scrolling down, and you can see it's everything you're normally going to find. It's the housing code helps in the full language of the code, which will help you explain it or reference it so you know exactly what you're looking for. It'll give you your conditions deemed to endanger, which you can look at right there. And then just a sample of what we call posting, because everyone should be posting. If you would go to the order to correct, Phoebe, please, which would be the next resource. If you could click on that. Now I know I made my order to correct. It meets all the requirements the state requires, but I made it simple because in Williamstown, it's a 2-part tear off. It's also on my computer, but you could also make this as a 3-part tear off to give to the property owner right there. It will list the violations. It will have your signature. It will show what violations have a 30-day window, what have a 10-day window, and will give each their legal remedies. And when I said earlier that the only legal advice I give to someone is what's on the back of that form, and on the bottom, in the Berkshires, we have 2 places where tenants can call to get legal advice. And we list those on, and that it's a simple, short, easy way to meet all the requirements of the Chapter 2 housing code for what your inspection should be. And it's just simple. I again, sometimes I do it on my computer, sometimes I bring a 2-part tear-off form with me. And if I'm with the landlord, I keep the original, he gets a copy, it's signed, he has everything he needs right there. I've
I would
given,
just add that you provided it on this webpage in both Word and PDF. So it's
beautiful.
actually in Word if people want to.
So you can, if you use it, play with it, put your own information in, put your town. And let's go back to the slides. I just wanted to show why.
Okay, do you want to just tell people though about the fees, like how you have an interesting staggered fee schedule for this? And I'll-
Sure, I can do that.
Okay.
When we're doing housing code issues, we have 3 separate fees, and this is because we've had a program for a long time where every property owner knows they're required to get apartments inspected and certified before they're occupied. Sometimes that doesn't happen. Sometimes property owners will call, oh, I had a tenant just move in, I really have to get this certified for them. Or I'll get a complaint from the tenant, hey, I've got problems with my apartment, I'll check on my database, it hasn't been certified. So Williamstown has set up a 3-tiered fee system for Chapter 2 housing certification. The first certification, when you do it before the tenant moves in, is a $35 fee, which is pretty darn cheap. So if the landlord obeys the regulation, it's a $35 fee. If the landlord, and by the way, you can use whatever fees you want. If the landlord waits and calls me and says, oh, I just rented this apartment, the tenants have moved in, I need it inspected, that just made my inspection a little more difficult. Because I've got to deal with furniture, I've got to deal with people, the cats, the dogs, the gerbils, whatever they have in there. But the landlord has shown good faith by wanting that unit inspected. But that's a $70 fee because it's more time. It's a reinforcement that it's always cheaper to get it done prior to occupancy. The third fee we have is if a tenant complains and the unit hasn't been inspected, I will go in, inspect that unit, do an order to correct, send that to the property owner and bill him $140 for that inspection. Now I know you're looking out there and said, oh, you can't do that. Mass General Law, Chapter 40, Section 22F allows you to set fees. And the Williamstown Board of Health doesn't just set fees. We made a regulation called Schedule of Fees because boards of health are allowed to make reasonable health regulations. And it's been determined to be reasonable depending on the level of non-compliance you have. We will charge fees, and it becomes a reminder that it's cheaper to get it inspected before the tenant moves in. We've done the schedule of fees for all our fees because in times when Williamstown our fees, there's a time limit for someone to get in an application with a fee. Let's say food establishment applications. Usually the code will say that has to be done by December 1st to get those application and fee in. The town of Williamstown, by having their local regulation schedule of fees, we've made every annual fee December 1st. And if they're late, there's a surcharge on that fee because it's an extra scramble. So we have a schedule of fee regulations and we set a different fee structure for Chapter 2. Usually when a landlord, unless he's totally or she's totally incorrigible, gets hit with that $140 fee, it's going to remind them, hey, maybe I'd rather pay the $35 fee than the $140 fee. It's called negative reinforcement. It usually works. Same with the late fee on everything else. And so that's the educational tools and the forms used. The educational tool is a cheat sheet. I will also email the Attorney General's landlord tenant guides, sample the form, anything. It helps that I've been dealing with a lot of the same property owners for years. My major property owners, I have their email address. So we email each other and I try to keep them up to date. They know about sub-metering. They know about changes to the building code, which could affect their next inspection. Because handrails are governed under the building code and how they use them, or something had changed under the building code that changes the way you do a chapter 2. It used to be, you used to have 3 risers on stairways before you required a handrail, a graspable handrail. The building code changed, it's now 4 risers. Just little things like that, I will let the property owners know about. Next slide, please, Phoebe. How to pass a local regulation. Want to get a drink of water first? Wonderful thing about being a member.
Step 1, hydrate.
Step 1, hydrate, breathe. Boards of Health, Mass General Law, Chapter 111, Section 31. You have the authority to make reasonable health regulations. And a lot of times you will make local health regulations to cover a gap that perhaps the state regulation doesn't have. So you have the Board of Health go over the regulation in the mid-1990s. Before they even went public with the regulation to elicit comment, the Board of Health went over the regulations using perhaps other regulations, looking at the housing code, and to say, how do we get to the goal that every rental property is safe? The Chapter 2 regulation doesn't require it. The Chapter 2 regulation requires that all housing meet Chapter 2, but there's not a mechanism for ensuring that for rental housing. So the Board of Health met couple times a month just to go over drafts of the regulations, make changes. When they were ready to go public with the regulation, there's a summary, not the whole regulation, a summary of the regulation put in the newspaper. Now let me back up. Mass General Law, Chapter 111, Section 31 says the only regulation you have to publicize and hold a public hearing on are anything to do with Title V. However, if you don't want the citizens of your town surrounding your office with pitchforks and torches, any regulation you do, you should have a public hearing on that. That way you're getting input from property owners, from tenants, from the community at large. And it has affected the way the Board of Health crafted their regulations, not just this one, but other ones. Lots of communities have regulations. I think MHOA may have a database of all regulations so that you don't have to start from square one. There may be other regulations out there post Williamstown regulations that may be more concise and meet your needs better than our regulations. Our regulations changed over the years to address certain issues that we found that, yes, they're in the code, but it was also better to put them in our local regulation. Whether that would be how to attend orders of correct. And there's a reason we did that, and I'll get to that. So you've had your regulation, you've posted your summary, you've gone to public hearing, you've heard the pros and cons. I think sometimes the only thing more contentious than a rental unit regulation would have been a smoking regulation. If you've been through the years of smoking regulations, after 30 years of not smoking, I still wanted one after I went through one of the hearings, okay? Just to calm me down. But rental hearings can be contentious. So your chair is going to really have to control that meeting. Speakers for, speakers against, written testimony. You're going to hear from everyone who wants to speak. You're going to try to cut down repeat comments, but you're going to want to hear from everyone. Everyone feels, and they do have a right, if you hold a hearing, to give their input, that you are listening to them and that hear them understand them, even if you don't agree with them, hear them, understand them. Then, once you've heard all the testimony, close the hearing. Once you close the hearing, it says vote either at this meeting or the next posted one. I would opt for the latter. Because you've just been through a hearing, it may have been a tense hearing, and you just close it, adjourn the meeting, go on to other business, say that you will further discuss and decide at your next meeting. Give a chance for passions to cool. Once the passions have cooled, you can come back, and even if it's the same people, they're probably not as heated as everyone during the meeting. Then you will pass the regulation. You will post that the regulation is passed. We post a summary and say copies of the complete regulations are available at. Usually it's my office, it could be the clerk's office at town hall. And then DEP still requires that you send a copy of the regulation to them. Williamstown, over the years, we have code people who do this every year for us, for our regulations. I will still send one occasionally just to make sure it's there, especially when it's just passed. But our code people usually make sure that DEP has the regulations. So there's your regulation. You've got it. Next slide, please. Phoebe, I'm going to give this one to you.
Thank you so much, Jeff. This is great to hear the details of how you do it. I of course, there are a bunch of questions for you in the chat when we get there, but I wanted to just share that we asked the Academic Public Health Corps, who I'm sure you all know about because we are regularly offered their services as local boards of health. But I asked them to do some research into who already has these regulations, and that project is still ongoing, but I thought it would be interesting just for you to see what they were able to figure out in the few days that they have been working on it. And essentially they are, what they're pointing out is that, thanks, Mark, North Adams, I'll add North Adams, that there's sort of a continuum of activity on this issue from most of the towns really only do inspections after a formal complaint is made, to a whole group of communities that require rental inspections, but on a multi-year basis, not on a new tenancy basis, and then pre-rental inspections required around tenancy, and then ones that actually issue certificates based on that. I'm actually not sure that the APHC is right that there's a difference between these two, but I'd have to dig into it a little more, and I just got their information today. So we will continue to get more information about what people have and get copies of their materials and links to their sites and stuff, and put that probably we'll put it on the WMPHA website. I think that's going to be easier than for you to navigate back to this calendar page where everything is right now. So back to you,
Thank
Jeff.
you very much.
Oh, never mind. That's still there. That's weird. Oh, never mind. That's it.
Well,
All right.
let me add a few things if we can go back to that last slide.
This
next
one?
Perfect.
This one?
Okay. Yeah, that's a great one. And just give me a chance. Williamstown, our regulation was set up that it's every year or the length of the tenancy, whichever comes last. Okay, so if I have tenancies change more than once a year, we have college housing, which may change more than once a year, something like that. Any change that happens more than once a year, I only have to inspect those once a year.
Ah, okay.
That doesn't happen often. It happens occasionally where somebody calls, hey, I just had it inspected. My tenant moved to somewhere else. I need another inspection. I said, I can inspect, and if you want me to, I will. I don't have to under the code, but should any damage occur, it's probably something you're going to be liable for because I can't certify it. So the property owner has that option. If a tenancy, I've had places I inspected in 1995, 1996, they're still occupied. I haven't inspected them since. unless there was a complaint. And that's how the Williamstown model works. We also have a couple other things going for us in addition to our schedule of fees regulation and our rental units regulation. We have a local fines regulation. Our local fines regulation just promulgated a couple years ago. It went through the Board of Health, went through some attorneys at a couple of the state agencies, or at least one attorney, and then it went through our town council. And just to make sure we could do this, and actually, the Board of Health already has a couple regulations they can issue the fines for themselves, and that will be your smoking regulations. And believe it or not, the wording of the manufactured housing community regulations, 940 CMR 10 allows you to assess that fine yourself. It doesn't say it has to go through court. It says there's a fine system. And I found, which is why we did the local fines, non-criminal disposition just wasn't an effective tool for us. It's, pardon the pun, it's a paper tiger at times. Being able to fine locally and issue fines for days of non-compliance, it's an attention getter. So we have on there, we have the schedule of fees regulation.
You want me to go back to the website and share that?
You can show that if you'd like, please, Phoebe.
Okay. Alrighty, 1 second. All right. And so everyone, this is the link I've been putting in the page.
Right.
You're talking about here, the local fines?
Local fines.
Okay.
And some of this, the genesis of this came from a town out east that I can't even remember where it was from, but they had a whereas page, and I said, okay, how do we make this simple and direct? And it's basically, you disobey an order or do not comply with an order from the Board of Health, we will fine you. And that works for us. It has worked. Again, it's one of those negative reinforcements that seems to have effect. Just a last note on any regulation you promulgate, give yourself at least a 6-month window before effectiveness. You need time to outreach on this. You need time to talk to people to make them feel comfortable, especially if they consider it the more onerous regulation. The town of Williamstown passed styrofoam and plastic regulations years ago. It was a town meeting regulation, but they graciously gave it to the Board of Health to enforce. They gave me enough of a window that I could go individually talk to every vendor of this and made them comfortable with it so that there were no problems. I've talked for 45 minutes, which is like more than I've talked in my whole life. So I'm going to turn it over to you, Phoebe, and any questions.
All right. Sounds good. And actually, we do have some questions. I'm going to do them in the order they came in. If some of you would like to ask your question, because there are not so many that you can't ask, let me know. But for
questions from Charlie Kinnicky, you can just skip right over those.
Okay, I'll blow right through Charlie's questions. Okay. Sure. John Thompson, do you want to ask your question?
Yeah, hi. Question about how you keep track of when these tenancies flip. How do you know? You depend on the landlord to tell you?
And that's it. It is on the honor system, and that's why we have the three structure fee. And you're not going to get everyone. There's always going to be someone who's going to try to play the system. And so you do the best, like anything you do in public health, is you do the best you can with what you have. When you do a restaurant inspection, that inspection is only a snapshot of what's happening at the time. Doesn't mean they're doing that all the time you're there, but you've got that comfort level.
Well, and I note also that your fee structure is basically another tried and true public health intervention, which is to make the healthy choice the easy choice, to make the $35 choice. It seems like the real problem is whether you have the time to inspect it in the time in this rental market that people have to switch. So I know that's one of the other questions is about like, how do you do the workload for this?
And some landlords are gonna be, I think I saw that come up from Aaron Hull.
Yes.
That where's the workload? The first couple years, it's hard to find the time. Because I was doing inspections and I was spending a lot of time on inspections and still trying to get the rest done. But once you get through that first round of inspections, it does get easier. Charlie's question just came up and I'm sure it just popped up in front of me. We're going to ignore it, Charlie. No, we're not going to ignore your question. Yes, anything that doesn't get paid, I turn it over to my treasurer collector, and she's very effective.
Thank you. The next question, Sandra Martin, do you want to ask your question?
I think it was answered for term rentals. You just basically once a year, unless they ask you to come into the Airbnbs, you don't go every time. That was really what I was going for. You answered. Thanks.
You're welcome.
There was also a question about, does this apply to mobile home rentals?
Yes, a rental is a rental. That's why title is rental units. Some units, believe it or not, rent isn't being charged. It may be part of their employment. Or a typical example is Williams College. They have TA housing, they have senior housing that they don't charge rent for. And Williams College is very good about their rentals. Of course, they have the wherewithal to take care of those. But Williams College knows, no, because they're not rental units, I don't have to inspect them, but they still have to meet the housing code should I get a complaint.
So do they just go ahead and get them inspected, or they don't?
They don't, and it hasn't been an issue.
Okay. We have Deb Vondahl from Athol is wondering about whether the fine system that you have applies to everything that the local Board of Health does, or just the housing?
The local fines regulation applies to all our local regulations.
Great.
The fee schedule is just housing. The fine system is anytime we have non-compliance with an order.
Gotcha. Now, Michael Mendez asked how many rental properties you have compared to inspectors. And I think this also would be interesting for some of the other communities that are online right now who also have this regulation. Like Erin, you were mentioning that, that those towns do. Like what's the relationship between the number of inspectors and the number of units?
It's changing because we add units, we lose units, but Williamstown probably has about 700 rental units right now. And we have 3 inspectors, me, myself, and I. But that's why I said, it seems once it's initially done, it's a workload you can handle, but that's something your town has to decide. Do you have the wherewithal, and can you do a pre-rental program? Or is your rental housing stock so large and your staff so small, it's easier for you just to handle it by complaint? And that's going to be your decision. Williamstown of 7,500 people, Adams of roughly 8,200 people, North Adams of roughly 12,000 to 14,000 people. They've decided it's worth their time and effort to ensure that safe housing.
That's helpful. Thank you. Another question that has come up is when you're in the second tier strategy, second tier fine, not fine, but permit category. So the place is already rented. What if the tenant refuses you entry?
That has not happened. And usually tenants won't do that because tenants want to make sure that they have safe sanitary housing. So I've never had the tenant refuse me to do the initial inspection. I have had tenants refuse me later to go into a place because based on a complaint from one of my other, let's say the wire inspector, the building inspector, the fire marshal, they notice something they want me to get into. And then I go, I knock on the door, the tenant says, no, you can't come in here. Well, then you have statements where you will attempt for an administrative warrant to do your inspection
Mhm.
in that case, but I've never had that happen on a rental inspection.
Interesting. I mean, one thing I'm hearing about the theme of people's questions around the workload is that probably this is the kind of thing it might be important to sort of temporarily staff up using the permit revenue, for that first year to try to get this happening. But there's a question from another person about, do you have any exemptions like a 2-unit owner occupied? Was there any kind of phase in the beginning?
There are no exemptions for rentals. If you're renting, you're renting. If it's a 2-unit, it's nice that the owner lives in 1 unit, because usually, because that exempts them from some portions of the code. Remember, we also fall back to the building and electrical codes for some of our things. Let's say the electrical code requires that the tenants have access to their circuit panels. If it's owner occupied, or if there's 24-hour assistance, they may not need that and we wouldn't require it. And the second part of that question, please.
Did you phase it in any way when you started? Did you, I guess you phased it in that you only had the time to do what you had the time to do. Presumably you didn't do them all in the first week or whatever, but was there any sort of?
The phase in was 2 things. One, it was giving them enough window to know what's going on. And just an aside, see your assessor, get a list of multifamily and mixed family units. That'll give you where they are and the property owners. You may not get all the single family units, and you'll get those eventually, but you start out with the multifamily and the mixed use units to find all your rentals in town if you don't know them. And then you basically you do not start inspecting until that unit that was occupied before you enacted the regulation becomes vacant after you enacted the regulation. That's what your window is.
That's the phase in, basically. Right. There was a question from Robin about, do you inspect units that have been occupied? And I think we've answered that. Yes, but they are charged a higher permit fee. There's a question that I don't think is for Jeff, but if other people want to answer, there's somebody in the chat asking what people's legal budget is. Because as we all know, boards of health often have a relatively limited access to town council. So if people would take the time to answer in the chat, that would be great. Question from Leslie Whelan, are your pre-occupancy inspections comprehensive or just the conditions that are deemed to endanger?
They're comprehensive. The tools I use when I go on an inspection are a flashlight, a tape measure, a thermometer, an outlet tester, and occasionally I'm bringing a moisture meter with me, just so we can be as comprehensive as we can without tearing down a wall or anything like that. You're going in for what you can see. I used to tell people I used to be able to see what was in the walls, but since I started putting kryptonite in paint, it made it impossible.
Thanks. I also know a lot of people were asking about scale of questions. So Mark Bushy, who worked in North Adams when this was, and did this work there, is reporting that they have a population of 13,000 and they did about 2 of them a day on a slow month. So about 30 to 60 a month. So it sounds to me like North Adams has a lot more apartment turnover than you do, Jeff.
Yes, and
yes,
North Adams, and there, when Mark was there, hi Mark, there were 2 Marks there. And one may be handling other things, one may be just dedicating himself totally to housing, which may be something to think about depending on your situation and staff.
Mm-hmm. Now, another good question we've had is from Stephen Casey about pushback or disagreement from town managers, select boards. I know that there can be very Well-connected landlords who might not like this idea, who feel that they work hard to make safe housing and they don't want another impediment to the rapid transition of their properties into renting. Did you face any pushback? And if so, how did you sell it to the powers that be in town?
One, no, I didn't face any pushback, but if you have an independent Board of Health, your Board of Health makes that regulation. The boards of health are probably the most powerful boards in local government. And if the Board of Health feels that it's a reasonable health regulation, that's the Board of Health's decision. That's what you go with.
Mark or anyone else who also has this regulation and was around when it was passed, does anyone else have an answer to that question? Like, did you have these conversations with leadership? I'm not hearing anyone unmute, so I'm gonna.
I've never had pushback from selectmen or town manager on how I do my job, because my job is to comply with state and local regulations.
Right. Okay. Thank you. Alex White is asking whether you ever bring a moisture reader with you.
I do bring a moisture. I will have one with me in the car. I'm sure to bring it if I get a mold complaint, just to see if there's a source of chronic moisture. But I do have a moisture meter. I can't think of the name right now. It's orange. It has a post with a round ball at the end. And I've been using that. I first got that moisture meter, and back when Tropical Storm Irene came through. It came through our senior manufactured housing community. Charlie was there with me, and so was Paul Hoffman, and we had to condemn.
That was terrible.
Over 200 units. They've all been out because of the flooding. They're all, but we had to condemn over 200 units, and then to go back and look at them later, if there were any that could be looked at later, because usually a manufactured home will fall apart. But there were a couple that were so well built that when it dried out, I could use a moisture meter, which has, every moisture meter will come with a range of what is considered wet, damp, dry, and to see whether they dried out sufficiently without problems. But I will use moisture meters on my inspections, especially if I think there's going to be an issue. And I carry one in my car with my Chapter 2 inspection stuff.
Thank you. Alicia McCartan is asking whether Williamstown requires short-term rentals to be inspected.
Not above. This is where, if there's anyone from DPH on this is where I'm going to get in trouble. But the Board of Health end of short-term rentals is actually quite easy. It's a Chapter 2 housing inspection. But once you discover them, zoning issues kick in, building code fire protection issues kick in. It's going to get ugly, and still waiting for the state to come to a resolution on this, because God, anytime somebody wants me to inspect, I'm not going to ask whether it's a short-term rental or whether it's an Airbnb. You want me to inspect, I'll inspect. I'm going to do that, because I'm not going to start doing, on my personal opinion is I want the state to come down with something solid on this.
And I will answer, Alicia, that in our impression here at the Franklin Regional Council of Governments, we think the state has, and we do permit them and inspect them. But we are happy to have a separate workshop about that sometime if people want to have that discussion. Because it is quite an undertaking to actually find them all and get them to actually get permitted, like every other temporary lodging.
Just noticing in Williamstown, at one way or another, I've been through, before they discovered short-term rentals, it was regular rentals, and I've probably been through most of them already myself anyway.
Yeah.
Just by default.
Clifford Pierre had a question about what advice would you give regarding implementing a measure like this for towns that have shared resources? I think you're talking about towns that are sharing public health staffing. I mean, my thing would be, it would be easiest if you all did it at once. You know, that would be my advice, is that you get the entire group of towns that is sharing inspectors and make sure that you all agree on a template that you then individually pass, so that you're not all of a sudden having a situation where people in your health district are experiencing different levels of public health protection based on which town they're in.
And I'm going to agree with that entirely.
Is it true that you can cite for moisture based on a moisture meter reading?
I have, because go ahead. Did you
No,
want
I was just gonna say, there's a question about that.
I have, and it has held, because you're using a measurable, quantifiable, impartial way to determine moisture. And remember, you're citing for chronic moisture. Section 500 of the housing code, we're looking at chronic moisture.
And it's admissible in court, the moisture meter
I-
reading.
Yeah, because I've used it.
Okay, great. There you go. Mark, I don't know if you're still here, but someone was asking how many inspectors there are in North Adams who were doing that work. So if you want to put that in the chat, that would be great. And all right, 1 second. How do you find out when a non-compliant landlord has changed tenants if no one reports? You wouldn't want to have this just inspect the good landlords. I think we've already kind of had that question, and basically your answer has been that once they're busted once and given slapped with the additional $140, that they usually don't do it a second time, right?
Eventually, if you're not going to get somebody's always willing to drop a dime on you. It's just the way things work. There's going to be someone who will drop a dime on you at some time, and you may not catch it all the time, but at least you're at the point where you can be comfortable. I've been in that unit recently. I usually find that the landlords who don't get the apartments inspected are the ones whose tenants are calling me, because they don't do other things equally.
Did you or Mark, when you were in North Adams, did you do like a huge, thank you, Mark, 2 inspectors in North Adams. Did you do a huge publicity push to landlords at the beginning, where sort of like where you went to the assessor's office or something and looked at every single multifamily and sent out information? Or, and is that among the resources you've provided for people here, is like what the letter introducing this to landlords looks like? I think I'm asking you, Jeff.
Oh, thank you. I thought you were asking Mark.
If Mark wants to unmute and answer, that'd be great too.
But back when I first started in 95, I do remember taking that list and writing a letter to everyone on that list saying, this is what the town of Williamstown requires. I haven't done it since, but in today's world, I try to do by email and other forms of contact. But when I initially got the assessor's list of multifamily units and mixed units, yeah, there was a lot of postage being generated for that one.
Another question is, does anybody, or have you heard, well, wait 1 moment. Mark, I don't know if you actually have a microphone and are able to unmute. Do you want to add anything to this? Oh, there you are. Hi.
Mark?
No, North Adams has had it in place for a long time, and it's actually a bylaw. The Board of Health didn't pass it.
Oh, it's a town bylaw, not a Board of Health regulation? And so were you there when the communication went out to landlords, or was that pre your
I
time?
want to say it's been in place for, I want to say the 90s or 80s. It's been a long time.
1970s, Mark. It was the you and Williamstown came in about the same time with rental unit regulations in the late 70s.
Isn't this a fascinating example of the wildly different patchwork of protections in Massachusetts? You know, that you can have communities who since the 1970s have been ensuring that every apartment meets minimum standards, and you can have 300 other ones that haven't. You know, it's amazing to me, really. Mark, is there anything else from what Jeff has been talking about that you want to share about like how it is structured differently or the same in North Adams, other than that it's a bylaw?
North Adams just charged a 1 flat fee, and I do like the idea of a tiered structure.
Yeah.
Because there was often, we ran into one where a landlord had rented property and it had been years he had been renting it. So the only way to kind of remedy that is we ended up finding him, and that ended up in the hundreds of thousands of dollars. So you end up having to tear the apartment out. So,
Yeah, I see. Okay. I'm not sure people could hear, but they have a flat fee in North Adams, and he's thinking that maybe the tiered one would have been more effective. But it's of course harder to change a bylaw than a regulation too, at town meeting. And then there was a question in the chat about whether there are systems where problem landlords are inspected more often. I will say that the only thing I know that's like that is if a neighborhood has been deemed slummed, blighted, then a Board of Health can pass special rules just for that neighborhood, but it is not landlord specific to my knowledge. Anybody else? John?
Yeah, in Amherst, we have a rental permit program. So all landlords have to register their property every year. And it's a self-certification for their units. They say that it meets all of the applicable building codes and health codes. And when we find out that they lied on that, they get put into a inspection program. So I'll go 3 times a year at $150 a pop, but look at that unit.
So that's very interesting. John, can you send me the regulation or whatever you have that describes it, and I will put it on the same page where that I'll send out to everybody?
Yeah, we're actually, we've got a new town council, and they've got rental properties in their sites, and they're rewriting our rental bylaw, but making it a little toothier and requiring annual inspections of all properties. So I'll let you know how that goes.
Good
It's
timing.
just me, so.
I see. Okay. Thank you. That's great. And someone in the chat has raised an interesting question about in those communities, say like Amherst or North Adams or Williamstown, that have some form of this regulation. How is a new homeowner with a multifamily supposed to find out about it? So you buy a home in one of these towns. What is the system in place for a new homeowner to learn, a new landlord, to learn about this?
We're asking realtors to let them know.
Ah, okay. Realtors like to do your bidding at the health department in Amherst. It must be working. That's good. Anybody else, Jeff or Mark, do you know what the system is? Does the assessor or tax collector, or, is there any sort of system set up where the town will notify new?
I'm going to agree with John, and it started out as a letter I sent to realtors years ago, and some of the calls I get are from realtors who are having Chapter 2 inspections done on behalf of a client. So the realtors are aware.
Interesting. Okay, good to know. Great. All right. I hope that answers that question. I don't see any other questions in the chat. Has anybody who has not asked a question have a question to ask, or wants to just share anything related to this work in your community?
Just don't ask the train leaving New York question. I hate that one.
Like on the GREs.
Yeah.
And we do need to say that the Charlie Konecki we've been teasing in this meeting is actually Charlie Jr. So sorry, Charlie. Sorry, Chuck.
I'll talk to you, Charlie, but you're really.
I want to remind people a few things. If you wanted CEUs for this from the Mass Environmental Health Association and you have not written me in the text, in the chat, please do so. I need your town and name and email address, but your email address I should all have in the registration in Zoom, so you don't need to give me that. And then just to remind people that in the short term, this calendar page that I keep pasting in has everything we've talked about, including this big guide on doing proactive rental inspection programs, a proactive rental inspection program from ChangeLab Solutions. It's a nice tool. And then everything that Jeff uses in Williamstown, as well as some other things that I was able to gather from, in this case, Chelsea Eastham and Salem. And we will also add the research that the Academic Public Health Corps has done and put it there. And I will put it all in a better place than FERCog's calendar and send you a link to that and a link to the recording that you can share with people. And if there are any other questions, you can unmute or put them in the chat. And otherwise, thank you so much for joining us. And I think I've heard it might be interesting to have a short workshop about fines. And it might like local health fines, and also maybe one about short-term rental permitting and inspection. It seems like those are both things that came up here that are tools in some people's toolboxes, but not others, that it'd be worth exploring.
Thank you for listening to me all this time. I appreciate it.
And many thanks to you, Jeff, for your willingness to do this and share your years of experience doing this. All right, have a great long weekend coming up soon, everyone. And I'm gonna stop the recording. Okay.